Hi. I'm here doing an interview for the Young Forum Gasteiners. I'm with Professor Henrique Lopes, who is head of the Public Health Unit at the Lisbon Catholic Research Unit. Yeah, head of the Public Health Research Unit at the Lisbon Catholic University in Lisbon. He gave us a very interesting session in the beginning of the event about gamification as a tool for health policy. So a few brief questions. The first one would be, how do you see the use of gamification as a helping tool in public health and policy?
Yeah. For sure, digitalization will go to increase, involve all public health and healthcare activities. So we need to have tools that help us in order to manage complexity. And this kind of decision-making tools will help in a high complex situation because they can put together epidemiological models and economics and give just one solution.
Okay. We also had another question about, so there's been many negative aspects during the pandemic related to public health, and we wanted to know if you have any insights to some positive trends that might be emerging in the field of digital health.
For sure. Pandemics naturally it was a tragedy, but at the same time improves in the mentality of people that works in healthcare, the decision makers, the facilities, the systems, and today is usual to have digital visit by the physician. It's usual to give more attention for post-surgery procedures, for example, at home with the research of digital tools, and lots of other solutions are appearing in prescription, in medical examination, in monitoring, in helping chronic patients. So there was lots of solutions that it was at the experimental level, and with the pandemics they was exploded in the good sense, in the good direction. And now we can use them in order to improve quality of the health services, in order to reduce costs of health services and provider organizations, and for increase to, at the same time, humanization of health service, because I must remember that health is not a technical issue, it's basically a humanitarian, humanistic issue, and digital tools can help to this dimension of humanism.
Okay, thank you. One last question. Would you have any message for young forum Gasteiners, young professionals who are interested in the area of digital health?
A scary one. A scary one. Okay. Your generation will go to face the biggest battle that humanity faces, at least what is written in historical times. At the same time, we will go to have a climate change that will go, for sure, will be a catastrophe. You will go to face food restriction in a generalized way. You go to face huge increase of infectious disease. You go to face different places for the traditional infectious disease, zoonotic, for example, and at the same time an ageism of the population. So what is the solution? Is not yet discovered, and we need to work for new solutions, better solutions in the huge complexity, and this is the challenge of your generation.
Okay, so thank you very much for your time.
No, it's my pleasure.